Hello and welcome to yet another episode of Hair Talk. My name is Dr. Joshua Chong and today we're going to be talking about eyebrows. Eyebrows play an important anatomical as well as aesthetic role in the face. What its anatomical function is to actually prevent sweat from dripping down into the eyes. But in terms of aesthetics, it's very important to have eyebrows to frame the face as well as to bring out the eyes. And you commonly see people with thinning eyebrows or not very dense eyebrows or unshapely eyebrows, and you start to think, why? So there are many causes of eyebrows being thin. Medical conditions can contribute to it. Things like hypothyroidism, alopecia areata, or frontal fibrosing alopecia can cause eyebrow loss. So can over-plucking your eyebrows, or you can be naturally born with not so full eyebrows or thin eyebrows. So what I recommend for patients with naturally thin eyebrows, I would always start them off with using this product, which is by Revitalash. It's called Revitobrow Advanced, and I've been using this for about 4 months now to thicken up my eyebrows. It's a very simple and easy to use application that contains peptides to naturally extend the length of your eyebrows, make it look fuller. It does not, however, create eyebrows where there has been already a scar tissue there or you've overplucked your eyebrows. Now, if you've already tried Revitobrow for a number of months and you still find that the results are lacking, you can always opt to do a little bit more. And that should come in the form of a surgical eyebrow transplant. Now, eyebrow transplants are used in patients with scars or burns across their eyebrow, or who don't like the shape of their eyebrow and want to enhance the shape of their eyebrow, as well as patients with thin eyebrows and just want a more natural appearance rather than going for an eyebrow microblading or embroidery procedure. So an eyebrow hair transplant procedure, it's slightly different from how you would transplant hairs onto the scalp for a few reasons. Now, the shape of the eyebrow is a very personal preference. First off, we would want the patient to do some research as to what kind of shape, what kind of design of eyebrow they like. And quite commonly, we would get our patients to draw on their own eyebrows or where they prefer the eyebrows to be placed. Of course, we're going to give advice to the patient as to whether that is aesthetic in appearance, or is it too thick or too wide or too far apart, etc. Apart from design, the directions of the eyebrow hairs are going to be quite different from how the directions of the scalp hairs emerge from the skin. So the angle of how we implant the hairs into the eyebrow area is very acute. We usually go at a 10 to 15 degree angle using special needles that we bend so that we can achieve the correct angle for natural growth. Very importantly as well is to notice the curl of the grafts. Looking under a microscope, you can see that each and every single hair graft that we've extracted from the donor area will have some small degree of curl. And that curl has to be placed in the appropriate fashion so that the eyebrow hairs actually grow backwards rather than away from the skin, which would give a protruding eyebrow effect or a very harsh brush-like effect. Now, I only use my most advanced and most experienced implanters to do this eyebrow transplant because this aspect of the design is so crucial to getting a natural appearance. So when you're doing an FUE eyebrow hair transplant, the selection of the donor area is quite important as well. Quite frequently, we would assess the entire donor for coarseness of hair or hair caliber, because a coarse hair or a thick hair caliber may not be so suitable for eyebrow transplant, making the eyebrow look quite harsh. But if you've got fine hairs, and that's usually located round the back, down lower in the nape of the neck, they tend to be very good grafts for eyebrow transplants. And usually they come as single grafts. We only use very limited double grafts for eyebrow hair transplants, and usually only in the main part of the eyebrow body, never in the tail or in the head of the brow. But like hair transplants on the scalp, eyebrow transplants will also encounter a period of shedding and growth. Usually the density starts to pick up at month 4 and will continue to improve up to 1 year. And during this period, the grafts that grow will not all grow uniformly. There will be a need for you to use some good eyebrow shears to trim the length so that they look nice and natural during this 1 year evolution process. And just like hair transplants, donor hairs that have been transplanted into the eyebrows will continue to grow and extend in length, and trimming them regularly is recommended and actually very required to keep the shape nice and neat. We generally recommend our patients to invest in a good pair of thinning shears for the eyebrows and trim their eyebrows at least once a week. An eyebrow transplant may require 400 to 500 grafts, depending on which areas are actually lacking in density or lacking in shape to fill, but sometimes we even go for full eyebrow reconstruction, which takes 600 to 900 single grafts to achieve a good dense and nice natural result. On the day of transplant and the day after transplant, be prepared for a bit of bruising, swelling and scabbing over the area, which usually heals quite quickly on its own. There's no need for any kind of special treatments after. What you really have to do is keep the grafts moist for about a few days, and once they heal, within a week, you're ready to meet the world. There's not too lengthy downtime like some people fear that, oh, it's gonna look like it's bleeding or bruising. We seldom encounter that in eyebrow transplants. It's important to note that men and women tend to have different expectations out of their eyebrows. Men usually want their eyebrows to be a bit fuller, a bit broader, but not so long, and have less of an arc. Women tend to prefer their eyebrows to have a little bit of extension past the lateral canthus, as well as have a little bit of an arc, but more slender in appearance. So do your research, look at different shapes of eyebrows, look at different celebrity eyebrows, choose a design that you think might suit you or a few designs before you come in for your eyebrow transplant consultation. If you'd like to know more about hair-related topics, remember to click like and subscribe. And if you've got any questions, please key them in the comments bar down below. Goodbye.